Fear and trust, issues people in the Latino community are facing when it comes to getting the coronavirus vaccine. NBC4's Kenya Ramirez spoke with an infectious disease specialist at Ohio Health about how they're trying to fix this problem and make sure that more people in the Latino community get the shot in the arm that they need.
Yeah, Darlene, infectious disease physician Dr. Edwin Vargas tells me there are several things you have to consider when you look at the percentage of Latinos who have gotten the vaccine. One is access to health care, two, the language barrier, and three, mistrust.
Ohio is growing in diversity each year. Of those, 4% are Latinos, yet the vaccine percentage is significantly lower.
According to the Ohio Department of Health, about 8% of the population has been vaccinated in Ohio. And out of that, about 2.3 to 2.4% have been Latino, Hispanic.
Are you surprised with that?
I mean, I think you have to take this number in critical terms. One, it's still very fresh information.
Dr. Vargas tells me to see those numbers go up, Latinos need to be better informed. He says a lot of them don't have access to health care, and they think they don't have options to get vaccinated and tested.
Despite of knowing that they have the virus, they don't have the way of isolating at home because, they live in this multi-generational homes.
Second is the language barrier.
Lack of access to good information. A lot of things are in English now, some are in Spanish. We're also been answering questions as much as possible.
And third, one of the most important right now, misinformation about vaccine eligibility.
The official statement from the Department of Homeland Security from February 1st that can be found on their website is that there should not be any discriminations in terms of race, ethnicity, or any other social conditions.
So I asked, what do they need?
They can show just a regular identification. ICE is not going to run any operations on doctor facilities. We're not asking for migratory status.
And Vargas says for those 65 and up who are eligible, they can call Ohio Health directly and speak with their translators if they have additional questions or concerns. I have that number on my web story on NBC4i.com. Live in the newsroom, Kenya Ramirez, NBC4.